there's been a couple of different efforts, mainly through two companies, Adalor and AstraZeneca. The Adalor, there's a lot of thoughts as to the targeting, what was being targeted. And in that case, it was peripheral pain states. And it could just be that delta agonists are not particularly effective for straight up peripheral pain states, and maybe better targeted for things like migraine. There's also some questions about the compounds that were being tested by Adalor in terms of how specific they were or how good they might have been as druggable compounds. In terms of the AstraZeneca trials, those ones were mainly for major depressive disorder. And so although the delta agonists didn't meet their primary endpoint in reducing depression, they did meet a secondary endpoint in terms of reducing anxiety. And I think that that's sort of interesting, because it did suggest that there was some physiological engagement with the target and that the agonist did seem to have a physiological effect. I think what was interesting about all the trials that have happened with delta agonists is that none of them have shown any significant or severe adverse effects. They've all been fairly well tolerated. And so I think that sort of speaks well to the candidate. And I think really it's just a question of finding the right compound, the right chemical compound for the treatment of the right disease. And I think that the right disease in this case may be migraine, considering where delta-opioid receptors are expressed, and considering the characteristics of migraine and how delta may regulate those characteristics.